How do dietary restrictions help electrolyte imbalance in CKD? Imagine your kidneys as the body's natural filters, keeping your minerals and fluids just right. When kidneys are healthy, they balance electrolytes like sodium, potassium, phosphorus, and calcium. But in chronic kidney disease or CKD, these filters don't work as well. This can cause dangerous imbalances that affect your heart, bones, blood pressure, and overall health. That's where diet comes into play, helping manage these tricky electrolyte levels. Dietary restrictions are a key part of controlling electrolyte imbalance in CKD. They help prevent minerals from building up too much in your blood. When your kidneys can't do their job properly, limiting certain foods reduces the workload on them and keeps waste and minerals from accumulating. This can help you avoid symptoms like swelling, high blood pressure, or muscle weakness. Let's start with sodium or salt. Normally, your kidneys get rid of excess sodium through urine, but damaged kidneys can't do this well. When sodium builds up, your body retains water, leading to swelling and increased blood pressure. That puts extra strain on your heart and lungs. To help, most doctors recommend keeping sodium intake below 2,300 milligrams a day. For more advanced CKD or dialysis, some suggest even less, around 1,500 milligrams. Cutting back on salty foods like processed snacks, canned soups, and fast food can make a big difference. It helps control fluid retention and blood pressure, especially during dialysis treatments, where limiting sodium can prevent cramping and blood pressure swings. Potassium is another important mineral. It's essential for your heart and muscles, but if your kidneys can't remove excess potassium, it can cause dangerous heart rhythms. High potassium levels, called hyperkalemia, can be life-threatening. Managing potassium involves eating fewer high-potassium foods like bananas, oranges, potatoes, and certain vegetables. But it's important to remember that some people with CKD can tolerate more potassium, especially if their blood tests show it's safe. Your healthcare team will monitor your levels and guide you on what foods are best for you. Phosphorus and calcium are also affected by CKD. When kidneys can't filter out phosphorus, it builds up in your blood. Too much phosphorus can weaken your bones and cause calcium deposits in your blood vessels and soft tissues. To prevent this, your doctor might recommend limiting foods high in phosphorus, like dairy products, nuts, and certain meats. Sometimes, phosphorus binders are prescribed to help keep levels in check. Maintaining the right balance of phosphorus and calcium is vital for healthy bones and preventing mineral disorders. Protein intake is another piece of the puzzle. When your kidneys work less efficiently, protein breakdown produces waste that needs to be filtered out. Limiting protein can reduce the burden on your kidneys and slow disease progression. But if you're on dialysis, your body needs more high-quality protein to replace what's lost during treatment. Your healthcare team will help you find the right amount to support your health without overloading your kidneys. Fluid intake is also important, especially as CKD progresses. In early stages, you might not need to restrict fluids, but in later stages or during dialysis, limiting water, juices, soups, and other drinks becomes essential. Too much fluid can cause swelling, high blood pressure, and strain your heart and lungs. Your doctor or dietitian will help you determine how much fluid is safe for you based on your urine output and overall health. Managing these dietary restrictions isn't a one-size-fits-all approach. It requires close collaboration with your healthcare team, including a renal dietitian who can tailor your plan. They'll help you read food labels, choose fresh foods over processed ones, and control portion sizes. Following these guidelines can help reduce symptoms, prevent complications, and slow the progression of CKD. Remember, always talk with your healthcare provider before making significant changes to your diet. They can help ensure your nutritional needs are met while keeping your electrolytes balanced and your kidneys as healthy as possible.